Yeah, thank you so much. These lectures are critical because it's all about empowering us, all health professionals, to provide safe gratification. And to provide that safe patient care is basically to decrease litigation. The litigation currently in our country, according to the Commission, the Law Reform Commission, and I had that opportunity to attend a workshop in March this year, and they refer to 120 billion rand of litigation pending in our country. Now that's really ridiculously high, very high. And I think if we have to go through that process, we're definitely not going to have health departments anywhere in this country. Mm-hmm. So there's this, I must thank you, Dr. Lesego, that for all these initiatives that you apply in Mpumalanga, and because we can all benefit from that. Also, you know, there's others, the new way of doing things is to connect electronically, and this allows that people nationally can also join. It's great, you know, really absolutely wonderful. So today we speak about leadership and management in clinical practice. I added the word management because we need to understand there's a difference between leadership and management. All right, so I'm going to, yeah, well, I can just now, I was told I must to give myself a start, I'm going to do this. Okay, so there we go. So there are a few objectives that I have listed for you that we'll go through. And basically, the first is the introduction. And the world today demands effective and ethical leaders. Leadership, first management, we just need to talk about that. Not going to dominate the management, but just to understand what is the difference between the two. Then the leadership styles, leadership in terms of direction and support, leadership in terms of the environment, and the stages of novice leadership, because we are always encountered with new people. And then I'd like to share with you the 21 irrefutable laws of leadership by John C. Maxwell. Perhaps many of you have heard about him, and also perhaps even those laws of leadership. I think these laws we can't do without, because if you apply them, you're certainly going to be a successful leader. Let me just take these pictures off here now. Yeah, there we go. The world today demands leaders who could lead in a complex environment, facing challenges. I'm sure you all realize that. And if one just take note of what's happening in the world today, it's absolutely, you know, it's just all over. Things are happening that are very challenging for the leadership of many countries. And take it further from a national, internationally, nationally, and down to where we are, just on a microcosm level, the departments, so on. We all have challenges right into your household. But we need leaders that are able to lead in these complex environments, because there are too many challenges that we are faced with. Changing societies, the diversity in religion, culture, cross-pollination of nations, the burden of disease, you know, and I mentioned a few here: TB, HIV, COVID-19, monkeypox, non-communicable diseases. You know, the list just goes on. Every time there's something new that we have to deal with. You know, monkeypox was now one of the latest things, and we were all so scared. I myself preparing to go for a holiday in the UK, and they had already so many cases in the UK, and I was just saying, I'm not going to shake hands with anybody. You know, we were pretty scared, you know, and I had to go on this holiday because otherwise I would have lost those credits. And then there's the financial volatility. You know, oh, something's happened. Oh, this thing has moved back. Okay, there we go. There's financial volatility. I'm sure you are watching what the rand is doing at the moment. You're watching what the petrol is doing. Hey, now some of the oil has come down a bit, but our poor rand is now again down in the dumps. Hey, it's 18 rand odd against the dollar, you know, little bit weak. But the pound has dropped a little bit, you know. So, but I don't think it will be for long. Those are just some of the talks with these new politicians that are looking for positions, and they talk all kinds of things about dropping taxes and so on. And you can see what's happening in England at the moment with their pound that's so very strong against all currencies. But it's fluctuating all the time, that one just don't know where you are. You have a budget, but sometimes your budget is completely depleted by this rand that loses its value all the time. Then the financial budgetary constraints. You have a budget, and if one just take the one example that we have at the moment about litigation, we don't budget in the Department of Health for any litigations. There's no such thing. What they do is then to rob Peter to pay Paul. They take money from your maintenance budget, gets depleted and used for the litigations. Where I am busy with some project work, in the Eastern Cape, and I think I mentioned that to you already. Well, and also there's a reference, if you want to go, you can also go and see what the Treasury said about their budget. I also found that in a reference with when I looked at the Law Reform Commission, the document they sent out, it was in that document as well that the budget of the Eastern Cape, basically the health budget, is much lower than what's happening with the litigation. It's much higher, and I remember Dr. Madonda was saying that they will soon have big problems, but they've applied interventions in their province. And I'm off to the Eastern Cape next week for the certificate ceremony, and we congratulate them that they completed over 50 students. They had 56 students, they paid for it, and 50 has now completed the program. So they'll get their certificates and attended by the MEC to show that they are applying some kind of intervention. Otherwise, we will always have this problem about budgets. So we also have to do more with less. That happens all the time. And one good example is always your petrol. That's well, for now it's coming down by R1 or so, but it's always, like a yo-yo, up and down, and it's more up than what it's down, causing problems and challenges for you, for the leadership of any organization, and more so in our health departments, because we're dealing with patients. Technology challenges that we have, there are many changes happening all the time in technology. We are just amazed what's happening in not only in the general use of things, but also specific in the health environment. Communication challenges, social network, Twitter, Facebook, all of this is challenges to us because these are changes. You still diagnose a patient and then they read up. I must share with you that I have started a process here at home also to put in some, to get myself out of the situation of being faced with the monster, the monster of the day that causes load shedding. And besides my batteries, I decided, well, I have to put panels in and strengthen the system. And there was some kind of tube that they were using also that would be exposed to the sunlight. And I said to them, I don't like that. And the gentleman said, but there's nothing wrong with that tube. I said, well, like patients normally do to us, I'm also going to Google and find out what are the pros and cons of that. You see, so patients do that. And sometimes they look at things that they don't understand and basically bring it to your attention or the lawyers. So these are also challenges for our, for the leaders. I'm just dropping something here that's blocking my view. Then there's the growing research in modalities of managing patients, telemedicine, and that has really been expanded. It's also moving out into, I'm getting something here. I just want to take it off. Computers are so sensitive, just every time it tries to bring things up. Yeah, telemedicine is going right into Africa. The Discovery is exploring that. So, more and more is being done with less money. That's what we are trying to do. The days are gone that you had to see a patient as a patient, you go to a doctor's surgery, basically, you must go to those rooms, you must see the doctor. The doctor also has no choice. He's not going to give you a prescript over the telephone. So, but those things have changed in that direction. So these are challenges for us. Now I must go to the next slide. I'm doing what you said. You are sharing. My slide is not moving now.
Use your mouse and then just click on it anywhere where you find space.
Oh, there we go.
Click. Yeah.
Okay, so then my next heading, let me just close this. There's something that came up here that I need to close. So our next objective then, the world today demands effective and ethical leadership, creative thinking, thinking out of the box, coming up with new things. That's critical. And this is normally the leaders that take the lead in this. The leader is the one that looks other side the mountain to see what's happening, what's coming, and come up with ways of doing things. I've just been reading, I'm not sure if you know the book, The Outliers, Story of Success by Malcolm Gladwell, where he describes what happened with the time when they had the depression in this, and how the Jews, became, they came from Europe over to America, and they were very poor, but in the family, one or two became lawyers, and they basically looked at where we were going to in the future, futuristic thinking. They were looking at, and despite the fact that people looked down on them, they basically came up with ideas that when the depression occurred, they were making money. They were making, because they were now looked upon as the poor lawyers and not such smart guys, but they became the top guys that really made a lot of money. So the next point, futuristic thinking. Today we have climate change. Hey, everybody's concerned, the leaders worldwide are concerned about what's happening in the world, with all this, the changes in climate, just about everywhere. Every day when you switch on the television, something has happened somewhere where there was an earthquake, there was, storms or it's extreme heat. Take Europe, for example. They don't know that, to have such very, very hot days. And suddenly now they had a lot of rain in one of the countries. I think it was Italy. But you have to think futuristic, even some of the things about using robots and all that. Sometimes I wonder now in our country where we need to empower people and give people jobs. I'm not so sure if that would be a good thing always to have the robots doing all the work in our country. Because I've seen that somewhere in France where the gentleman, managing the roads just to show you to slow down. We have people standing there. They have robots. Somebody standing there and just showing them to, waving them down. But we need this in health. And this is leaders. This is how they think. The leaders never rest. They're always thinking about things. How can they do things better? They are visionaries. Being able to collaborate, work across disciplines, diverse cultural societies. We don't have the past anywhere where you find that leaders are sitting or organizations are working in isolation. And in health, more so also, if you're an academic at the universities, you are forced to do research on a national and international level. You have to show that evidence. At Stellenbosch University, you will not become an associate professor even if you have not done some research with across, other countries and involved, maybe Germany, the EU, or there's the Americans. So, and you have to show results that you've done that. So before they can basically promote you. I remember I used to say it's harder to become a professor than it is even to do your own PhD, because they expect so much of you to do. But that is the way to go today. You cannot sit in your office and think that you are the alpha and omega, that you know it all. You have to share with others. understanding organizational culture, critical, understanding your own organization and others also, read more widely. And not only academic books, in preparing this lecture, I use books that's not normally prescribed. I've just mentioned one to you, the outliers. These outliers are these guys that like Bill Gates, for example, how they made it. They're outliers, the other one is also the very famous one. Well, if I'm thinking of Jobs, they were born more or less 1954, 55. Those guys that came up with the computers, and there was a time that the PC wasn't such a, or should we say computers wasn't such a big deal for the world. And suddenly, it just expanded astronomically because of the PC that they introduced. And I mean, it just goes on and on. Every time there's something new software, and you're getting tired of it, always changing. Then it's version 10, then it's 11, then it's 12, and it's going, I don't know where we're sitting now these days. But I'm always being told by the university that now we got new software. So Microsoft is keeping us on our toes. And in the meantime, they are also making money. It's because of the vision that these guys have, these leaders, and understanding what we require worldwide. The leadership is not only knowledge, clinical skills, working silos, as I explained, and being the great researcher. Those days are gone when you sat in your office and thought that you were doing something. You need to form partnerships, collaborations, example, and even in our country, the SADC, Southern African region. Now I'm again got something here that's blocking my view. So I'm just going to push this a little bit down. Form partnerships, collaboration, example, the SADC, Southern African Development Community, BRICS, Brazil, Russia, India, China, and South Africa. And this is how we progress, as a country, by learning what others are doing. If you think of the way how apartheid went, what happened to us in the past, and that has now slowly gone away, helpingly. But how did we solve that? Many other countries want to learn from us. I was recently in Ireland, and I saw Madiba's picture, a painting of him on the walls, showing what they thought of Madiba, and in these discussions to assist them in Northern Ireland to come to a solution with their problems that they had. And the problems wasn't, it was between Catholics and Protestants, and that I could understand, that they all Christians, but they have this fight in inverted commas, between them. And there's a wall that's about 3 stories high. I also wrote something on there that the rights for everybody is important, and there should be tolerance amongst people, So Madiba is also not only in Ireland. I also saw that in Wales at one of the castles. They have pictures of Madiba now. Now that says something about South Africa, that they could learn from what we have, that we've been doing. How did we solve our problems? So this is against background why it is important for our leadership today to be effective and ethical in what they're doing. And the last time when I spoke also on risk management, I mentioned the fact that with Africa Day, one of the speakers, a professor from UNISA, said that we have everything in Africa, everything, gold, diamonds, oil, you name it, we have it, copper, and the list goes on. But what we don't have and that we lack is ethical leadership. We have a problem with that, and that needs to be strengthened in our country. I have to change now, I have to do magic here again. There we go. So now I want to just talk about leadership versus management. So what is the difference? Is there a difference? Do we need both? Are good leaders also effective managers? And are good managers also effective leaders? And that we need to answer. I always ask students, do we need both? We certainly do need both. That's for sure. Because we need to be effective managers and we need to be effective leaders as well. But the difference is that the leader, the picture on your on my left, is that the followers are moving with the leader. And if you look at the opposite one, your manager, always concerned about time, always concerned about, are we keeping to the protocols, the policies, the regulations, the laws, are things done on time? At 8 o'clock, we do this. And I'm reminded of the tea, the coffee that they give out in the morning to patients. The patients are sleeping, but 5 o'clock, the general assistant will put down a cup of coffee there at that patient's bedside. By the time he drinks or she drinks a coffee, it's ice cold. Instead of asking the patient, would you like to have coffee at 5 o'clock? Do you normally have coffee that time? Or would you rather not go with coffee, or do you want it later? So that's a bit of caring. If we could just ask patients that, because when the patient wakes up, he sees this cup of coffee standing next to him and it's ice cold. We're not, and then it's still, maybe it's even winter. But this is what managers are about. They are about time, that they do things the way it is. And I thought I'll put this picture here, saying that it was supposed to be for the nurses. But if we are not good leaders, effective leaders and managers, this is what the day looks like for that nurse manager. She doesn't know if she's coming or going. So I'm still with this leadership versus management. Let's define a definition. The leadership means the ability of an individual to influence, motivate, and enable others to contribute towards the effectiveness and success of the organizations, of which, I have to just take this away here again, of which they are members. Management comprises directing and controlling a group of one or more people or entities for the purpose of coordinating and harmonizing that group towards accomplishing a goal. That's the important thing. They are constantly aware of that, what they have to do. Every time I move that, then I have this problem. The screen is paused. Where would I resume share? There we go. So to continue the differences, now I have to put this. What's happening here now? I have to get my. Let's start from the beginning. I have to put. I need my full. I need to continue, not to start from the beginning.
Yes.
What's this new share? New share?
Yes, you can just go to your right lower side, as low. Can't see your mouse.
Pause the share. I don't want to pause. I don't want to stop it under your screen.
Yeah, you just want to put it on full screen. If you can take your mouse cursor down to those words written display settings at the bottom of your PowerPoint. Do you see it?
Supposed to see it. Let me just see. Wait. I'll lift this up.
Yeah, there you go, Prof. Thanks. Click there.
Yeah. Okay. So we've done. I have a problem with this, that I'm sharing, and then I have this thing that comes up. I need to push it up there somewhere.
Yeah.
But I won't be able to read my headings.
Maybe so what you can do is to stop sharing and then reshare again, Zoom. I think it should sort itself out.
Okay, let me see if it can go.
Okay. Thanks.
Okay, let's talk about the personality styles of these leaders and managers. Is that the leader are often called brilliant and mercurial. Those are sudden or unpredictable changes of mood or mind with great charisma, yet they are also often seen as loners and private people. They are comfortable taking risks, sometimes seemingly wild and crazy risks. Among almost all leaders have high levels of imagination. a leader, if one have to put it, it's like somebody sitting on sits on Table Mountain, and he looks at Cape Town and he thinks, how can I change Cape Town? How can I do things better? Cape Town is not the way it should function. We need to turn Cape Town a bit. That's how they think. They are always imagining how they can make things better. That's part of their creative minds. What about the manager? They tend to be rational, under control, problem solvers. They often focus on goals, structures, personnel, and availability of resources. Managers' personalities lean toward persistence, strong will, analysis, and intelligence. You got the picture. You probably got that picture what happens in the ward environment. And that goes now for all of us that are health professionals, that, how when you get into the ward, how that sister in charge will say, no, it's not time now. You need to come back at 10 o'clock. No, we don't do it this time. You just have that, and I experienced also as a youngster going through my clinical practice, I had very strict RNs that were, where I worked. I remember the one that when I was a student, that just out of the blue says, you're standing there in a group and you're having now a discussion, but suddenly, we're speaking about patients, and then she asks you what's the color of the aprons of the general assistants, working on the clean side of the ward, or what's the color of the aprons of those working on the dirty side of the ward. And I remember being a first, second year student, I thought, wow, did I have to watch their aprons, what color it is? You see, so those are the managers. They want everything must be according to the way the protocol is. This is how we do it at 7 o'clock. This is what we do at 8 o'clock, at 9 o'clock. The leaders tend to think all the time about how can they do things better. They take risks. They're not happy with the way things are done all the time. And this is how we change things. It would have been a very dull world if we didn't have these risks. People are wanting to go stay on Mars now. That's a big question. I'm not sure if if that is a good idea, but there are people that are keen on going there. And then the approach to risk, role in decision-making styles. The leader, is a risk-taking person, facilitates. They transformers. That transformational leadership skill is very strong in them, that they don't just manage things the way it's been like that the last 10, 15 years. And then they have a consultative and participative approach. They will always consult with their followers. And if they have thought of something, they won't just come onto their followers, the team, because they're part of that team, and say, well, I've read about this. What do you all think? Can we analyze it? And, not everybody sitting around that table should not be scared of saying to that leader that I don't like your idea. Right? They should be able to challenge the leader, and the leader will accept that. Now, what about the manager? They avoid risks. They are involved. They dictatorial, authoritative. Oopsie, now my stuff had disappeared.
Sorry, Prof, your slides were not moving. Try to reshare your slides.
As I share, okay, so I share screen.
Yes.
Again, okay, fine.
But funny enough, as you were teaching, we could see the slides. So it's quite.
You could see the slides.
Yes.
Oh, so now I've put it up again.
Yeah.
So I have to put the slideshow.
Yes, thanks, Prof.
Okay, we still on. Do you see this slide?
Perfect.
Okay, so we've discussed the approach to risk, role in decision making. So what about the power? Power through charisma and influence. While that's now the leader, but your manager is normally appointed formal authority and position. So, and they will make you aware of their positions. It was not so long ago, I had to do something, and this person said to me, no, I'm a deputy director. so that this person wasn't going to come and assist. She will send somebody to that. There's somebody that will do that. Whereas we as leaders, we tend to work with no matter what the situation is, that influence your followers, the subordinates, just creates a vibe amongst them that they want to be supportive and want to assist. Well, with the manager, people are normally, the subordinates are sometimes a bit scared of taking the steps or taking the initiative, which must change, because we don't need that in a work environment. As strong as you are as a manager, you must be as strong as a leader as well. And in the organization, leaders have followers and the managers have subordinates. And with the leader works with their heart and the manager works with their head. Interesting. Okay, I'm going to change. There we go. So the question was, do we need both? Yes, we need both. And this is how you can, we can put it together, is that both of them have goals to accomplish. Both of them have to explain the vision, the organization, figureheads, motivate others, mobilize resources. So you look at your leadership roles, the vision and the strategy. They will always think about, what's the vision of the Department of Health? What's the vision of this country? If I'm at the university, we must strictly keep to the vision and the strategy of the university, because the senior management of the university, they went somewhere in a Bosbarat and they sat and they worked on something. It comes down and it filters right through to the departments. It's exactly the same in the Department of Health. It will filter down, right down into the wards, that you are aware of the vision and the strategies that has to be applied as a leader. And that's why, while the manager always is concerned about policies and procedures, it goes together. You cannot leave, work in isolation. Just be a good leader, but the poor manager in your ward is totally, or the departments that you're in charge of is upside down. The things are not ordered. There's no coordination of what's going on. Laissez-faire kind of department. So leading is creating value, influence, and inspiration. They have followers, they're leading people. People are focused, charismatic style. They're risk and change seekers, appeal to the heart, proactive, sets direction, raising expectations, and ask questions. Think of your current situation in the country. I think everybody's cross for what's going on in our country with ESCOM. They now want to change the board. Do you think it's going to help? Is the board going to help? Did the board do any changes for the past couple of years since 2008? That's a very good example there that one could take what's happening in ESCOM. Were they good managers? Did we have good leadership there? Were they aware that you don't have, that whatever you have needs maintenance, that things need to be renewed? The same. Let's go to the Department of Health. Let's go to our health departments, the wards, the clinical environment. Those fancy things that we have bought and have put in place a few years ago, it gets old. It don't stay new. It needs to be maintained. There was a time that I was at the Office of Health Standards and we had to go and do some inspection somewhere. And interesting enough, I was at that particular hospital 40 years ago. And that was the last, the same things, the way it looked that time. Now that I came 40 years later, it still looked the same. So that tells you that there's no progress in what, there's no, the leadership, it's not like it should be. And the management, both are ineffective. So if you really want to be a good manager, you have to keep the policies and procedures, counting the value, the power and control. It has to be there. Have subordinates managing the work focused, authoritarian style that is normally dominating, but it must also be versatile. You can't always have that one specific type of leadership style is dominating. It changes according to the situation. The risk averse and stability, appeal to the head, reactive, plans, detail, maintain status quo, and give directions. So the bottom line is between these two is that you need to be an effective leader and equally so a good manager, because it shouldn't look like there's a bull that went through the whole wards and turned everything upside down. And all you do is that you sit and dream about how can you change, That's what leaders do. They sit and dream about things. They visualize how things can be changed. Take the Microsoft, how Bill Gates, how he thought about that. He's born 1955. Right? And he had this vision. And it's just, he's given over because there's part of his leadership style is that he created new leaders and he led leaders that he's not even actively busy there anymore. But Microsoft didn't come to a standstill. And this is what leadership is about. Can you see that? Are we okay? So we talk about leadership styles. A leadership style is defined as a set of behaviors that one consciously chooses to use that best fits the situation. When the situation changes, so does the style. So let's look at that. And these are the leadership styles that everybody's familiar with: autocratic, transactional, democratic, laissez-faire, transformational. But what is it that we need in the health environment? Essentially, to be too democratic and then things stand still because you need to consult and you haven't consulted yet. And so you said, I'm still waiting for this one to come. I'm still waiting. So one must not dominate one particular leadership style. So let's just talk about that. And these, the transactional, there's the transformational leadership. I want to discuss this with you so that you then see which one is the one that is required in as that needs to be applied in the health environment. So transactional leadership styles are more concerned with maintaining the normal flow of operations. Transactional leadership can be described as keeping the ship afloat. Leaders use disciplinary power and an array of incentives to motivate employees to perform at their best. The term transactional refers to the fact that this type of leader essentially motivates subordinates by exchanging rewards for performance, does not look ahead, does not function strategically. While the transformational leader goes beyond managing day-to-day operations and crafts strategies for taking his company, department, or work team to the next level of performance and success. Transformational leadership styles focus on team building, motivation, and collaboration with employees at different levels of an organization to accomplish change for the better. Transformational leaders set goals and incentives to push their subordinates to higher performance levels while providing opportunities for personal and professional growth for each employee. So what do we need in the clinical environment? Transformational leaders. We need leaders that can transform an environment. You walk in there, it's interesting enough when you listen to these politicians and when they tell you that, oh, we're going to do this and we're going to bring down the taxes, like if I just think of what happened in the UK when they had to choose a new prime minister. And the prime minister, the one that's now the current that was elected, she kept saying, I'm going to drop the taxes, I'm going to do this and I'm do that. And everything was very smart. And then, of course, now, people love to hear that you're going to, if you're going to be able to put more money into your pocket. So that's where you're going to put your cross. You're going to vote for that person. So this person has come in. And today I just saw some heading that she acknowledges now that her plan is not working because their pound has dropped tremendously. They've lost a lot of money at the moment. So what was that? That was all about, that, I want to change, but that change wasn't really for the better. There they made a big mistake in what was planned. As leaders, we think very carefully about what we are proposing. And you basically looked at the pros and the cons of something, and then put it forward and for discussion, and get the input of everybody in that group. You know, I've said it last time that we are basically all just dots on a circle, and you need the input of everybody that's in that team. You cannot run away from the team and take your own decisions and then walk into the office and say, you know, I've been thinking all about this, I'm introducing this. Transformational leaders bring about change with the people that they work with. That's critically important. And you develop your leaders as time goes, because you are the leader, but you're not going to be there forever. So you have to develop those leaders. This is where you plow in so that there's succession planning, you know, that people grow, send them on for study, you know, on study leave, or give them opportunities to attend conferences, to improve their qualifications and all that, so that you at the end have leaders within the leading in that group. Think of Bill Gates. You know, I'm now reminded of it because I've read his story at some stage, that how the people that work for them, what they give to their program leaders, the team leaders, what they get, and how they then come up with new ideas. You know, the creativity is very, it's critical, and for the environment that they are in. You know, there's always that competition to do better and better, because they will just say, now what has happened to Bill Gates and Microsoft? Have they got stuck? So they have to always think of something new. This same in the health environment. We cannot get stuck with the way we do things. So we have to sort this out, and this can be quite a critical situation if we just allow everything to go haywire. So this is just a picture to show that, you know, you don't know if you're coming or going. Now, there's a very important statement on the top here that I want to read you. When it comes to leadership style, one size does not fit all. That's important. Effective leaders provide leadership in terms of both direction and support on the basis of each person's maturity in the task they're undertaking. Leadership style has to be appropriate to the person, the context, and the task. When anyone takes on a new task, they begin at the dependent level, right down at the level. You know, you're completely dependent on the next one to guide you. At the end of the continuum. They then move up the maturity scale. As they develop, they move up. And I'm sure all of us at this seminar tonight, we have left that level long time already. We have grown. It's now for us now to keep ourselves up to date all the time. You know, that's where the CPD comes in. And some of us at different speeds, some go slower, some, you know, with the experiences, the ability, knowledge, self-esteem, all plays a role. You know, eventually people can ask you something and you will be able to just provide them an answer without having to consult the book or anything. Okay, so now I'm going to push this up again. Let's put it there. So let's just look at these 4 quadrants and just see. The first is directing. My doesn't show the bottom part, but okay. So if you look at the arrows on my left, increasing support, and at the horizontal level, can you see the horizontal level? I have something here that's now blocking that. Is that basically here is your increase in basically in directing is on the horizontal level. So the lowest stage, that would now the dependent stage, at stage 1, people need to be told specifically and regularly what to do. They need constant reinforcing and corrective feedback about whether they are accomplishing their task correctly. They need clear goals, role responsibilities, direction, and training. They also need to spend time with their leader. So at this level, it's directing. You're basically guiding this person. This person is on the lowest level. And this may not only apply to neophytes that's entering the health environment. It could be somebody that's going to specialize. And now I want to be a surgeon, but I haven't been in a theater. They need to orientate me. They need to show me around. You have to start at the bottom by guiding us. And slowly we get smarter and smarter. That we get to our next stage is coaching. Now the person may be encountering difficulties, blocks, and setbacks. They still need a high degree of direction, but the amount and nature of support they require increases significantly. They need regular reinforcing and corrective feedback, and a leader who can constantly support and recharge them with the next steps in the plan. This requires a significant investment of leadership time. So here, there's a support. You can still coach them with what they are doing, but they still need your support. And these are normally, if you take the student training of nurses, this would be the third-year student that now, these are the most, what we call the senior students in the ward, but they still need that coaching. They need guidance. They can't be left on their own. You need to be there. And your third level, because now the maturity, they're becoming more and more mature. By this stage, the individual is becoming more confident in their ability in the task. They are also more able to decide upon what is needed to move things forward. However, they can't be left to get on with it. So they need to be able to participate in decision-making with their leader, trying out ideas with them and having these expanded and built upon. So you find that in this situation that they will come and talk to the leader, and leaders should be open for any of the followers or subordinates in the clinical environment to hear what they are suggesting, what they are saying, and to guide them. Perhaps we should this way. What do you think? That is, I always make the comment about that. If I should get very sick, I'd like to be managed in an academic hospital, because I will then have the professor there and a few consultants, and I will also have the clinical assistant, and there will be students, and they will all have some input into what's happening to me. But if I lie in a private hospital, there's only one person that decides, well, I think we need to remove your appendix, and then maybe it's not the appendix. Maybe we have to do this, or maybe, and sometimes there's so many trial and errors that happens. So, well, sometimes it's all, things do go off. Well, I'm exaggerating a bit, but it's a fact that it's just one man. And that is why it's important that even in the private sector that they introduce groups, team, people that can work together. And I believe that is happening now, especially in obstetrics. So it can be that one needs that support. You can't just be left. And if you get to the fourth stage of your maturity in the clinical environment, is that then, things can be delegated. As a leader, you can now delegate, and don't be scared of delegating, and feel that you as a leader, you're the only one that can do what can be done. You must be able to trust your staff and be able to delegate, because you delegate with responsibility, but you are still accountable for whatever goes wrong. And that is why your staff, who you're working with, who are those that of the staff members that you can delegate to specific tasks, and who are the juniors that are there. So this is the ideal stage for most leaders, as they want to be able to rely upon their team members to successfully complete tasks relatively independently. By this stage, team members need only to be given the goal, and they can take it from there with the occasional base touch to be sure they're on track. Then, just to put this again in context, we're continuing with the leadership styles, is that you have then the 4 quadrants, just to show that you have, if you move from my left to the right, directive from low to high, directive behavior. If you go on the vertical column from the bottom, low to high, supportive behavior. So in S1, in that block, as we just said, it's high directive and low supportive. High directive. As you move up to the next stage, it's high directive and high supportive behavior. And that's your coaching area. And in your 3rd quadrant, the low directive, but a lot of supporters still have to be given on this level. And lastly, in that 4th quadrant, delegating. Now you can delegate. It's low directive and low supportive behavior. And you need to know your staff that's working with you. And whoever you employ also, you need to know what they've been doing. So look at their CVs, look at their strengths, what were they good at. There's, I'm not so sure, and it's probably still, there was this thing about having changing staff from one ward. Every month there's a new change list. It's good to change your students from one ward to the other so that they can get basically an experience, in the various specialities. But if you have staff that's working in urology, make them good urology RNs. It's like surgeons. You find that the surgeon will go and he'll specialize in urology, but he's not going to change next month to something else. Now I'm going to do ENT, and now I'm going to do general surgery. They specialize in a specific field and become a fundi in that area, if I have to put it that way. But the nurses in some hospitals, and I hope it's not like that, because it was something that I tried to say that it's the wrong approach that we're applying. We should basically make specialists of the nurses in specific areas. So if it's nurses working in ICU, RNs, and they're good at coronary care, why not keep them in coronary care? Because when somebody walks into that unit and asks questions about coronary care, she should be able to talk, or he must be able to talk and give the history of that unit. He must be able to say how many patients they normally see per month, how many patients they see per year, and what's the prognosis of the patients, the age group. And this is how you get to know your environment. And this is what leaders should apply to create leaders out of leaders, not just, that we change from one point to the other. It doesn't make sense. It was something when I was in the clinical environment, I said, it doesn't make sense. We need to have our staff, nursing staff specifically, to be able to specialize in the areas where they are working, and not say to them, now, I think you must go and help there now, and I think you must go and help there. And despite the fact that they tell you that I don't understand, I don't know what goes on there and so on, I can just basically go do the basics. That's all I can do. But the more specialized care, like for example, if you take somebody and say, look, I need you to now go and help in coronary care, and she knows nothing about ECGs, the real things about ECG, all the irregularities and the things that goes on, the arrhythmias and so on. It's not going to help having her there. She basically just going to ask other patients and how you're feeling and do the full wash and do things, but you won't be able to read those ECGs. So one must be careful how you do things with that. All right, so that was now just to explain in these 4 quadrants, basically where's the high directive and low supportive in the directing quadrant, where that dominates, and then the coaching is 2, what happens there is 3, supportive environment, low directive, high supportive behavior. And of course, in the last one, it's always nice to have these senior nurses in the ward where you can delegate, I don't know, to those with the 4 stripes on their shoulders, and those are the seniors of the ward, and you could ask them to do things, and they basically just consult with you if they are doing the correct way. But also that would be students, but take it further. You could have your RNs work with you, and you need to also understand them and their levels of competency. So then your leadership styles according to the environment. So it changes because you could be authoritarian, you could be participative, and that's important to know to know your staff, because let's say, for example, now you have a crisis, the environmental crisis, and you have an inexperienced subordinate. Then you have to be authoritarian, because let's say there's a heart, now it's not the case you're busy with somebody that just had a heart arrest, and you have to ask, please pass, give me that. You have to basically assist that person, authoritarian, where if it was somebody that had a little bit, was more capable, she would know exactly already each tube that's going to be used, the number. She will just say number, is it the number 8 that you require, or 7 or something, But with somebody that's inexperienced, you can't just leave them on your own. Then you're asking for trouble. And I've explained to you the last time I mentioned where we had the ComServe nurses, right? That have completed their 4 years, now they have to do their ComServe, and the regulation is clear that they still need to be supervised. And these 2 ComServes were left alone, and the patients came in the morning. This is one of the comprehensive healthcare centers. Patient came in very sick and was waiting for care, and she probably got up and walked out. And finally, the family came to look for her. And where did they find her? Dead behind the building. So, but those 2 ComServes, they were not equipped to basically although they completed their program, they still needed supervision, because we have identified that they need that kind of internship to be assisted still. So who's at fault? Not the ComServes, it's actually the leaders that were not at fault because they were left alone. That's actually very sad. So if we go up, if there's high growth or a changing environment, there's still authoritarian relationship between the inexperienced subordinate and the leader. And if it's a stable environment, it could be participative. If you go to the capable subordinate, authoritarian on that level, if there's a crisis, environmental crisis, and on the next level, high growth or changing environment becomes more participative. And then further up in the stable environment, participative. You have now time to ask, what do you think? Have you got any suggestions? And that's important, because people feel good when they are asked to participate, that they are also recognized for what they know. And you boost people like this, because then they go out and they do more for that environment because they are being recognized. And our third level is our experts. The expert subordinate is participative from the word go. On the next level, high level growth or changing environment also. And of course, in a stable environment, you can then delegate to them. So your leadership style may change within one day, depending on the situation in that environment. And just to share with you the stages of the novice, how they basically grow, is that and become competent, and how you get to the level of expert. We've all been on the novice stage. You have no or minimal experience, and this is normally the first 2 to 3 years. They follow the rules and regulations. The novice becomes an advanced beginner. But as time, as they develop, and with more and more exposure, they become smarter. We must just basically invest in these young people. And if we invest in the right way by being there for them, we will have very, very competent, proficient experts soon. And that should be our goal. Not to have the attitude, which happens is that the college lecturer must come and help, or the university lecturer. I'm not your lecturer, your university lecturer must come and help you. They're there, they're doing their practice. They need the practice. You can't have the academic sitting on top of them the whole day. So while they're busy with their practica, we as the leaders within that clinical environment must invest in them, take them and teach them all about urology, ENT, general nursing, what general surgery, whatever the situation is, or if it's a condition, patient has diabetes, discuss the condition. And that's how they become smarter by the day. Somebody one day, when I was also there many years ago, I was walking around in Cape Town, and somebody touched me on my shoulder, and she said to me, "Hello, sister, and how are you?" And I didn't even recognize her. Isn't that sad? But that was now some years later. And she said, "I remember you so well because you taught me this and you taught me that." And that is what one wants to hear. You know, it's years later, somebody comes, touches you on your shoulder, greets you and speaks and gives you that compliment that you now, they remember that. And that's those encounters with your young nurses or the young medical students. They won't forget. They will always refer to it. Then the next level is the competence stage. According to Bremer, 1984, competency develops when actions are consciously viewed in relation to long-term goals or plans, a sense of mastery, coupled with an ability to cope, a growing degree of satisfaction in the role. Hey, you're becoming smarter. That's what it is. And then proficient phase, based on experience, a leader learns what to expect and how plans need to be altered in order to achieve set goals, enhances effective decision-making, no longer require multiple experiences to review options in decision-making, uses own experiences. And the expert stage is the expert leader functions from a perspective of understanding the healthcare setting and has an intuitive grasp of situations as it arises. But we need to understand these levels as leaders of our staff, that where are they? Are they on the novice stage? Are on that second level competence stage? Are they proficient? Are they experts already? You know, it's very sad when we treat an expert like a novice. And you will get a very negative reaction from those experts. You say, you know, this RN thinks that I'm still a student or something. So we must understand the levels of your staff. Now, these irrefutable laws of leadership that Maxwell refers to, and it's basically all of these layers, and I simply just love to share this with students. There's 21 irrefutable laws of leadership. And he says that if we follow them, and people will follow you. So let's look at the first one. The first one is the law of the lid. Leadership ability determines a person's level of effectiveness. Now, this law of the lid, some of us tend to crawl into a cocoon. You know, we have the lid on. We don't seem to lift the lid and expand ourselves and thinking about how can we do things better. Or what can we do? And I'm going to give you the example of the Mcdonald Brothers and Ray. Now, he describes it in his book, John Maxwell. Is McDonald's, as we all know it, that's not, was never brought about by the Mcdonald Brothers. They had in the States, they were making hamburgers. They were selling it, but only in their small environment. They didn't think further than that area. And the gentleman that came along, Ray, made them an offer because he realized he had this vision for McDonald's that one could actually expand McDonald's so far that you can make millions and billions out of it. You know, it don't have to be only in that small environment where the McDonald brothers were doing very well, but they were doing well in a small place. They didn't lift that lid of looking beyond the environment and seeing how they can put better. So the deal was that I take over your business, I retain the name McDonald's, and it's my business. And that's how McDonald's is today. It's not because of the Mcdonald Brothers. They started it. They sowed the seed, but they didn't lift that lid. They didn't think further. We need to become explosive and really look beyond the mountain, what's going on behind that mountain. Is there something hiding somewhere that I need to explore and see? And that's how we grow and become smarter leaders for your clinical environment. The law of influence, the true measure of leadership is influence, nothing more, nothing less. Think of Princess Diana. She won over the world, the whole world, despite losing her title. And still today, they think the world of her. She basically influenced the late queen that passed away not a few weeks ago, 2 or 3 weeks ago. Right? She influenced that whole royal family. They were the stiff upper lip kind of people. And she was down to earth. Her sons had to be taught, to be almost like normal people that understand what's going on in the world. And now you see that there's changes in that royal family and the effect it had on them to make that change. But Diana basically influenced many people. If you go to England, where I had a nice holiday not so long ago, we were at just walking through the Kensington Gardens, and there was the Kensington Palace where she stayed. It was open to the public. And then I also noticed that they had a playground, the Princess Diana playground, so for children, and that was for free, So they have been honoring quite a bit in her, for this princess, the effect that she had. And that is the law of influence. And that is a very important aspect, an important law for our leadership. How are you influencing the staff that's working with you to do better, to go and explore and come up with new ideas in your environment? We need that. We desperately need it. With budget constraints and all the problems we are faced with, we need this kind of leadership where you have that you're not working alone and thinking that you have the team behind you and they are so influenced that they carry on. And then there's the law of process. Leadership develops daily, not in a day. Theodore Roosevelt helped create a world power, won a Nobel Peace Prize, but we also had Madiba, 27 years in prison, and he also won a Nobel Peace Prize. But it took years. It was a process. You're not born a leader. You actually develop. You may have some, maybe some traits that may lean that way. I always say all the April babies, especially the April ladies, are leaders. The Queen was born in April, and I'm born in April. So I'm teasing a bit now. You don't see me, and I'm smiling about this. But, leadership, that skill you need to develop takes time. It takes time. It's not something in a day. I see some nice faces coming up here. They're laughing and crying. The law of navigation. Everyone can steer a ship, but it takes a leader to chart the course. Now you must think of this example, the presidents of South Africa, Nelson Mandela, Jacob Zuma, and Cyril Ramaphosa. You can now come to your own conclusion, how that law of navigation was steered by Jacob and Nelson, and now currently Cyril Ramaphosa. You can think about that. The law of Hutton, when the real leader speaks, people listen. That happens, when they walk in, that really, they suddenly just have everybody's attention. Well, a church minister will have it by nature of his work. But Colin Powell, the first US African-American Secretary of State, he had that ability, that when he walked in, people just listened to him. And there's quite a lot that Colin Powell can teach us about leadership. The law of solid ground, and this is important for us as leaders. The trust is the foundation of leadership. You need to have trust in your staff. You need to, that is why we spoke about that you need to know your staff. You need to trust them so they can feel that trust. And if you break the trust, it's going to be very difficult for you to build that trust again within your group. So trust is the foundation of leadership, and you can add the ethics as well. Critically important. Honesty, that whole integrity. Now that's what I'm adding, not what John Maxwell is saying, but trust, ethics, those key focus areas of good models, it's basically all encompassed in one, that your integrity, it must be solid. Then the law of respect. People naturally follow leaders stronger than themselves. That's exactly, but you need to have that respect for all of the staff that's working with you. And that's the way we talk to each other, how we honor each other, how we respect their values, what they come with, whatever they speak, they talk about, not to basically downgrade people. That's totally unacceptable to do that. Really unacceptable. The law of intuition. Leaders evaluate everything with a leadership bias. Critically important that one must be careful of bias within your environment, right? That you evaluate, because the staff is clever. They pick up quickly. There's bias in the situation here, that. And and you're going to lose staff in that way if you start having to favor people. So you evaluate everything with the leadership bias. And the law of magnetism, who you are is who you attract. And you need to, it's if you're a good leader, if you are always an example, a role model, you do what's right, you listen to others, you will attract people automatically. It will come to you. You don't even have to go out there and stand on somewhere, and basically like an orator and talk. You don't have to do that. It's just the way you are. That law of magnetism to draw people to you. The law of connection. Leaders touch a heart before they ask for a hand. You can actually just feel it. And it happens, I'm sure many of you had this experience already, and you can perhaps connect with some of these. The law of the inner circle. The leader's potential is determined by those closest to him or her. Right? The law of empowerment. Only secure leaders give power to others. This is important because by developing your staff, you are creating succession planning also, because you're not going to be there always. The leaders, your staff should feel good about what you are doing for them. Only secure leaders give power to others. Those that hang on, and I'm sure some of you must have heard that about the old nursing staff. There were old ones that, I remember somebody said to me when I was a young RN, and I was always goal directed. So this person said, do you want my position? Do you want my post? And that's not the way, they should actually be happy about that. You are basically you are being groomed for a position that when they're not there, that you will be able to take, that you will be able to take up a position and continue with that. That's what it's like. We have to develop the youth of today, because we're not going to be here forever. Then the law of reproduction. It takes a leader to raise up a leader, which we've just spoken about. The law of buy-in. People buy into the leader first, then into the leader's vision. I'm reminded of this latest politician that's now formed a new, I almost want to say the new kid on the block, but he's not so new, but he's come up with a new party. My reaction was another party. And many people have said that probably another party. It just weakens all the votes because you have only so many votes and everybody getting a little. So Basically, so I mean, people are probably asking that. First, now, we first have to see, buy into the leader first, then into the leader's vision. Where is he going toward what? Then the law of victory. This is one thing about leaders. There's victory has no alternative. They want to win. And they and remember, they're working in a team. Leaders work in teams. They don't work alone, but they want their team to win. So I always refer to the teams as the A team. We are going to do better than best. And it's the whole team. And they all get recognition for that. And you can go and read quite a bit about history. Just think about Churchill. Churchill basically also kind of, when Chamberlain, the prime minister before him, now this is a movie that I saw, and that's now one of my strengths. Look, I like history. And the prime minister at the time when he started taking over the countries, Chamberlain had an opportunity to speak to Hitler, but he couldn't convince him. And more of the countries were taken up, and then Austria also went. And, Hitler was now going to start bombing the UK, England. And then it's basically Churchill was the one that defied him and just said what he wanted to say. Because to Churchill, there was nothing else but victory, which did happen when he connected with one of the American leaders. And so it happened. And that's why everybody thinks the world of Churchill, because he basically, they conquered that Hitler, and then the end of the Second World War could happen. But it must have been a very, very sad time at that time when you have one leader. Now it reminds me of one leader in our current time that is now trying to gobble up the Ukraine and all the little countries around in Europe. They're not big. Finland is not big. Sweden is not big. They all basically are very, very scared of what's going on, because this leader, the Russian leader, has only one thing in his mind, is victory. He wants to win. And that's why all the youngsters are being written up now also. They must also now go and fight. And it's causing a lot of problems. So we'll watch what's going to happen. But that's not the good side of a leader. We don't want that type of leaders that do that to people. But this is one of the traits of leaders. The law of victory, they want to win. And then the law of Big Mo, using every opportunity that it's keeping the momentum going. And according to Maxwell, he says momentum is a leader's best friend. With enough momentum, nearly any kind of change is possible. And I say to you today, if there's opportunities for you in the clinical environment that you can use, don't hesitate. Use an opportunity. If you can see that you can get very good outcomes, then use it. I'm one of those people that love opportunities. I see the situation, that there's the momentum I must create, where there's a gap, we must try and use it. It's with my funding opportunities that I had, identifying the problems we have in our country, looking for funding, for example, and I'm giving you examples of myself now, looking for funding because I identified there's a gap, and we got the funding. And now I'm nearing finishing off with the second group in the Eastern Cape, 60 students at the moment. And I'm already thinking of which other province can I help, that I need to now look for more funding so that I can help another province. So, and by doing this, is that we're helping patient care. This is where it drives to. That's the bottom line, safe quality patient care that we would like to have. So there is another province in fact, I tried the last time, so they said, no, I must finish the one project and they'll consider me for the next project. So use every opportunity that you have in your clinical environment. Somebody walks in and say, well, we see that your the hospital looks really very poor, the environment and all that. And as we have lots of money for you, then, to give you, to sponsor, then listen to them and take it further to hear if you can take the money so that there's a sponsor that's going to beautify your hospital and make it look good. It's nice if patients come to your hospital and it looks good. It's something that they always look at. They look at the wards, they look at the environment, they look at what changes have you made to your hospital. It mustn't look like, the day when you started 20 years ago and it's still the same. It has to change. Then the law of priorities. Leaders understand that activity is not necessarily accomplishment. And I quote Stephen Covey, "A leader is the one who climbs the tallest tree, surveys the entire situation and hell's wrong jungle." That's if it's the wrong, maybe that activity that they've applied was not the right one. This is an important thing that one must learn to prioritize. What is the most important activity that needs to be applied, and what are the consequences? Weigh it up, look at it, and then evaluate if that particular activity was the activity the way it should have been, for example, as Stephen Covey says. And that's also another good book that you should have on your shelf, the 7 habits that he refers to. Then 18th one, the law of sacrifice. Now, really, a leader must give up to go up. And I quote, "You become a leader, you lose the right to think about yourself." When you become a leader, you lose the right to think about yourself. You continue just working and doing things and sacrificing time. I was told in the house here that, don't you think you have done now enough sacrifices about the community engagement that you are always involved with? And what's my answer? The day when I close my eyes, then that will be the end of the journey. But as far as long as we can give to develop our country and to give to contribute to safe quality patient care, we must do that. So those are leaders. That's the law of sacrifice. Leaders sacrifice. They are busy doing things, changing. I was there in Mpumalanga. One of the RNs said to me, she comes in on a Saturday and her children is good at making pictures, and then they go Saturdays, Sundays, weekends, and they go and work in the clinic to make things, to beautify the clinic. And I was very impressed, and I said to her, well done. That's what leadership is about, those sacrifices, because otherwise your place will look the same every day. There will be no change because clinics are very busy. We don't get time. We have to sacrifice some time to make changes. And then there's the law of timing. When to lead is as important as what to do and where to go. And you hear this, frequently we hear it was the right time to do that, or it was the wrong time. When the right leader and the right timing come together, incredible things happen. But it could also be the opposite, that if the poor leader and the wrong timing can be disastrous. So that is also critically important, the law of timing, to evaluate that, is this the correct time to do this now? Hey. And one can just learn from these politicians and the things that goes on around us. Then there's the law of explosive growth. To add growth, lead followers to multiply, lead leaders. And I want to say, be careful of cheap labor. That's my ad. That's not what Covey says. But indirectly, he refers to that you use people that are experts in your environment, that are competent to do the job. You cannot use, and this is a sad situation happening, and that's why we have the high levels of litigation, because adverse events are growing. That's exploding. And that shouldn't happen. That should be a turnaround. And they have shown in research that where the RNs are nursing patients, the adverse events are very low. There's hardly adverse events. But we have and this applies to private health as well, is that we have now in ICUs and in the wards, we have 1 or 2 RNs running a big ward with lots of patients. And who's walking around? Assistant nurses, staff nurses. We don't have many RNs walking around. So we've just gone the other way around. We have more non-registered staff, and the registered nurses are fewer. And that's why we have this increase in adverse events. And that has been shown in the States, where they have turned it completely around. And I walked there in their wards, and I saw just RNs and 1 or 2 assistant nurses who then goes and fetches the things that you need, but the RN is at the bedside and your litigation is at its lowest. Adverse events just don't happen, and they are equipped. So we must not go for cheap labor. That's what it is. And always compromise safe quality patient care with budget constraints. We're not worried. We rather the budget or profits. We think of profits and we use cheap labor. There are articles that we published and research we've done showing that the nurses that are not nurses, these are actually the helpers, the carers in private healthcare. They say that they are the people doing the care of the patients, and the sisters sit in the ward, sit in their offices. That is what that study showed. So that we've done, one of the master's degree students completed, and we had that study also published about the role of caregivers. Interesting enough is that that study with, I think the student that decided to do the study, she was involved in the HR environment of the organization. And she actually wanted to show how valuable they are. And I had to keep her and keep saying, you're not to be biased. This is research. Don't show now that these carers are now very valuable, that you need to improve more. No, you have to please prevent bias. And that was really constantly, I had to remind her. And then when the outcome came, these people were saying that they do the work while the RNs sit in the office. So that it's not a good thing at all. And then the last one, the law of legacy. A leader's lasting value is measured by succession. So this is one of the things that one always hear when the Americans, right? What legacy is he going to leave behind? What are they leaving behind? Right? But if you have started something, you've developed and have developed your leaders, the people that worked with you, and you go away, things go on like you've been there, that you are still there. And even better, because they then build on that. That's the law of legacy. It shouldn't be a negative legacy that they remember the bad things, because very quickly, they remember something that's not good. And I remember reading something about Colin Powell, for example, when he died. I think he died last year. He died of COVID. So despite the fact they were speaking so well of him, they came up with a negative thing about the war, what happened during the war. So because he was also a colonel or some sort in the war, and they remembered something about that, that the guidance he gave to the president at the time was incorrect. So that was actually something that now kind of smeared his whole, all the good that he did, because you read about him and there's a lot of good about him. And then in that, when he passed on, they came up with this negative thing, that the war in Iraq was actually, he misled the president. So those are the 21 irrefutable laws of leadership. And if you apply that, always constantly aware of it, you'll make a good leader, let me tell you. And leadership and success is a dream, doesn't become reality through magic. It takes sweat, determination, and hard work, says Colin Powell. To lead yourself, use your head. To lead others, use your heart, John Maxwell. And finally, my last slide says, my conclusion, Everything rises and falls on leadership. Leaders can make an organization and they can also break an organization. And you remember our problem in our country that started also in 2008 with all this capturing, state capturing. There was a problem with the leadership, because that is why we had all that problems. Imagine capturing a state, my word. But nevertheless, this is what John Maxwell says. He says the personnel determine the potential of the organization. Relationships determine the morale of the organization. Structure determines the size of the organization. Vision determines the direction of the organization. And leadership determines the success of the organization. That's my last slide. I thank you. Good. Let's put that back. Thank you, Mavela, Dr. Mavela.
I had not unmuted myself. I was actually saying I have had, a lot of your talks, but today's talk was not talking to our minds, but to our hearts. I think, it's quite empowering. And for me, it is going to leave me very, very inspired and really motivated to continue, where we left off, today. So really, 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 I so that I have a very dark skin. If I was a bit light, you would see that I'm a bit reddish. That means I'm blushing. So, with my skin color, I can only go more gray when I'm blushing. But yeah, it's empowering. Thank you very much, Prof. Colleagues, it would be nice to hear one or two of you, live, raising your hands just to say something to Prof, how you feel. I saw a number of people. I don't know if Dr. Sigitla is here. I know he always shares very positive messages around leadership. I've seen we've got some medical managers, Dr. Pule, are you a medical leader or a medical manager? How does it work? I saw a number of nurses as well, commenting. But I saw, is it Nomsa from Free State? She was saying, maybe you should come to Free State with this training, Prof. I don't know, what's your next province? What were you planning to where were you planning to go? Just
that I can actually say that was the province.
Oh,
I've been working with them.
The next one. Yeah.
Yeah, so let's hope so. I spoke about it today and yesterday also to my admin assistant, that the application must be in by 18th, normally the 18th of December, but I have to finish my one group that I'm completing now, 60 students. And then I'll start talking to Free State again, because the last time they were very keen on me coming there. But we must look for the funding. We must get people to assist us. Yeah.
Yes, Prof. Getika, I might be pronouncing your name a bit incorrectly, but you may unmute. Thanks.
Good evening, Dr. Mavela, and good evening, Prof. It was such a empowering and informative talk that I'm still not wanting to go away. But I have a challenge. I work for the Department of Health, and when I see the other departments like having their own surgeries and doctors running just coming for an hour or so and then running to your surgeries, and to them it seems all normal, but it's very demotivating for us when we see that we are working the whole day and the others are just coming here for the sake of money. Or you don't see that compassion anymore in professionals to serve. Some of them would even say, we are doing a favor on these state patients. We are so qualified. We deserve more. And, that is very demotivating when we work our asses off and other departments, psychologist, social worker, or physio, they will just come and go, and some days they wouldn't come and go. And I was always a whistleblower in my institution, and I was reporting these things to national and everywhere. Nothing happened. So I'm just quiet now, and I've just decided to settle down, and I'm thinking that I'll wait for God's punishment for these people, or God must only do something, because, you know, they know all the higher people in politics, in ANC, in the parliament and everywhere. But I used to feel very depressed when I went to work, when I see all the other sections are gone. They come and sign once in a week and go, and they have no statistics. So to me, I don't know how to solve such a situation where I'm helpless. And how do you manage such a situation where people are corrupt and they don't want to work in the government sector? And who do you complain to? Because if you complain to your bosses, they are also involved with these people, and then they threaten you to suspend you or to fire you. You know, you just keep quiet and work. So it's very demotivating when such things happen, and I don't know how to go around it. But now I felt so empowered after this, that no, there is hope.
Yeah, there is hope, you know, as a leader. Yeah, as a leader, you should actually basically try. I'm just trying to see where's my so I can just the video. What must I do? Stop the screen, or what must I just?
Yes, you may stop there. Yeah.
There we go. Yeah, you know, it's bad if we have such attitudes. So if they don't want to be there, then they should actually rather leave, so that you rather have people there that's more positive. And you must, sometimes it's very difficult, because if you see there's this issue, but there's also possibly a room for improvement, then I think maybe one must create a team approach, that you get your social worker, your physiotherapist, your OT, get them together to say, listen, how can we make a change? You have to take the initiative. Somebody must take the lead. If you don't do something, then you know, and you just feel despondent, then nothing's going to be done. I remember we started a project because, you know, with the New South Africa, I had just started at Stellenbosch University in '94, and I asked them, what are you going to do now for the New South Africa about change? And they looked at me, you know, well, if you want to do something, then you can do so. I said, oh, well, then I will not be put off by my colleagues. And I also then looked for funds, and I spoke to the students. And then I thought, now, where can we start to make a difference? And I went to the church minister, because I need now a place that don't have clinics. They don't have it. And only the ministers will tell you where there's areas where they really need students and engagements, you know. And he said to me, I must go to Paternoster. Paternoster, you know how far that is? 168 kilometers from Cape Town. And I went with the students. Some of them have their own cars. And we went there. I first went to explore the environment and met with the shopkeeper. You know, I had to start somewhere. But this minister also said to me, what do I hope to achieve? So I said to him, you know, and he said to me, it's like a drop in a basket, in a bucket. So I said, you know, have you ever realized that every drop can fill a bucket? So years later, when I met that same minister, I told him about Paternoster and the work that we've done there. We were there about 3 years with the students. I still have photos of them, and we worked there. We've got pictures. We took blood. We even just identified that town was hypertensive. Young and old had hypertension. You know, we took many, and they had strings. They had a clinic that stayed closed. Eventually we got the clinic. We made changes to that. So I'm using this as an example, because in your small way, you can start something. Start talking to maybe to the physiotherapist, and then there's the OT, but get them involved so that you can make the change, so that they can feel they're part of the team. While they're not part of the team, they'll come and go, you know, because I've got 2 patients in this ward. I'm just quickly going to check them out. You must make them part of the team so that they can feel that they can also contribute and make a difference to that particular ward. And everybody in your hospital can make a difference. And that's what it needs to be done. And that's, I see somebody's writing about sacrifices. Yeah, and those are sacrifices that we as leaders have to make. You know, hours and hours that you spend doing things to make sure that at the end, you're safe quality patient care. You contribute to that. You know, you can make a difference in your community, in the hospital. So that's one of the things. And then the visibility. I wrote here, I just made, you know, while you were talking, you know, it's the attitude that must change, that you create that positive. And visibility, very important. If you're in a managerial role, that you have a few awards, make sure that you as the leader are always visible. Give them surprise visits. You know, it's not like you're going to check on them. Go on ward rounds. Go around with you know, sometimes the nurses in their leading positions think that it's just the sister that must go on the ward round of that particular ward. No, as a nursing service manager or a leader of a few wards, you must make time to go on a round with those, with the doctors. I was also a chief nursing, professional nurse, chief, and then I was a nursing service manager. But I had my plans that I would go, and I remember I had 310 beds that I had to see to. And it was surgery. We had general surgery, ENT, plastic surgery, you name it, everything. And there were 10 wards with at least 35 patients in each of those wards. But I went on rounds with those doctors, and not to see if the nurses are doing their work, but that they felt that I am part of that team to contribute to the care of the patient. And they will consult with you. And I'm going to add these words: we earn our worth. Not what we look like, we earn our worth when we do that visibility, that they know you are there and that you care. And they will even miss you. So my master's degree was about improving the quality of life of laryngectomies. And I introduced, it was controlled. It was a controlled study because I had a group that was not on this plan that I had, basically. And then there was the group that had to be. But the people that was involved was this whole team. It was the OT, was the professor of ENT, with his consultants, with his clinical, the husband, all of them formed part of that team approach. That was important before they would do a laryngectomy. They all had to have input with the patient. They have spoken. And so I even invented something during that process, because you know, to have a hole in your neck and everybody sees this hole here and you make, and then all the muck comes out. So I invented the first TSP in the world, tracheostoma protector, you know, that they would put on, and it would basically, it would be cosmetic. It doesn't that big hole that you see there. And then of course it had a hygroscopic membrane in. It would basically, when you breathe in, normally it's dry. That's why they have the crusting. So now when they breathe out, they humidify that membrane. And so consequently, all the air that came in was humidified. So it took the functions of the nose, you know. So that's the type of involvement. Now, why do I say this? I earned my worth with the doctors. Those doctors, remember, they retired. But I could see them anywhere and they would chat to me and talk to me about things. Even in the car park, they see me. But earning your worth, and it's about clinical care, not just that you are managing. You are effective in how you manage, but you are an effective leader and a clinician, a clinical nurse to be there for the patients. That's important. So visibility is critical, and your team approach, get them involved, put them together.
Superb, Prof. Superb. Today, it's like we could have you for the day. I want to put Dr. Pule on spot. He's a medical manager in one of the institutions. Just to talk about Dr. Pule, has this presentation affected you in any way? Is there one point to take home to your hospital tomorrow? Dr. Pule, if you are able to unmute, it would be nice to hear your voice.
Hi, Lesego. Good evening, colleagues.
Yes.
Thanks, Prof, for the informative presentation. Yes, the issue of workarounds as leaders are very important, because to me, they're like a vehicle for staff engagement, where you get to identify issues and correct them there and there, and use them also as teaching moments, especially for junior doctors and junior nurses. So it's something that we have started, at Ladysmith Hospital as a team, nursing together with the medical team and the systems department, where we unlock issues, For example, we went into one ward and the toilet was leaking. So within 2 days, it was fixed. And it has been reported for the past 2 months as broken. So it does help, Prof. I can attest to that. And one other thing, colleagues, I put it in the group, in the chats. It's about clinical leadership. I'm a senior manager of medical services. I'm in charge of all the doctors and allied health professionals in the hospital. But we have been crippling, with the implementation of clinical governance. And I put a question, Prof. Okote, how can we, harness the potential leadership amongst clinicians? Because they don't want to get involved. And one of the reasons is that management is not part of our undergraduate curriculum as doctors, unlike with nurses. Nurses, they are better managers. I'm sorry to all the doctors. Nurses are better managers, So we are clinicians. So what message can you give us, Prof, in order to turn around this situation? Because our head of clinical government, they don't want to get involved in quality improvement, projects. They rather stay in theater the whole day, operating. So I will stop then, Dr. Lesego. Thank you.
Thank you. Thank you, Doc.
Yeah.
No,
thanks, Dr. Pule. That is exactly what we need to do, is that slow approach of getting the teams together of each one. We did it. I did it with urology. I did it with general surgery. I did it with the ENT people, with all of my places. And the things we introduced with them as quality assurance. And I spoke to these leaders. I had those meetings with those leaders, the head of health. Now we're not talking about the head of the province. We're talking about the head of that discipline, the professor in charge or the consultants. I had meetings with them. I said to them, if we want to improve quality patient care, we need to work together. And I introduced them the auditing. I explained to them that we will audit documents. We'll go once a month. We'll do all kinds of things that we make sure. Identify indicators, your indicators like your pressure sores, infections, and so on. And also display that in the ward. But they must be part of that. And I got them basically to even sponsor awards for the wards, awards for the wards. Yeah, that did the best, And we had trophies, and they would give something special for that. But that was getting them involved. We need to, if they are a partner to safe quality patient care, we need to sit down and talk to them, because they are part of it. And they must make time for that. They can't want to be operating every day. There's no, theaters must assign specific days for specific doctors. Okay, then general surgery, then this. So there are days that they are open to basically have these discussions because they want to be winners at the end of the safe quality patient care that's been given, but they can't do it alone. And neither can the nurses do it alone. You have to do it as a team. Yeah, the East, I mean, just say Eastern Cape is considering also that we give short courses to the doctors in leadership and capacity building in management and leadership. So that's another project for the Eastern Cape. We'll hear next week because the MSc is also going to be at our certificate ceremony. Oh, it's quite a day, the whole full day here.
Super. Prof, let me ask Dr. Sikitla to officially make his comment, but importantly to thank you for today's session. It's someone I regard highly because of his motivational himself. Dr. Sikitla, are you able to unmute and just appreciate Prof for today's talk and anything else you might want to say? I saw you've mentioned a lot around mentorship in the chat.
Mm-hmm. Mm-hmm.
Are you able to unmute, Dr. Sikitla?
Oh, yes.
Yes.
Yes, I did. Okay, thank you, Prof. I think what is lacking in our situation here, it's leadership. As we have said, that everything rises and falls on leadership. There's a nice quote which I like to say, which states that an army of sheep led by a lion and will always defeat an army of lions led by a sheep. So you can see from there that leadership is very, very important. Now, our problem here, we just go, we just improve, and you are a prof now. Then you find that now you are not mentoring others to be better than you. So there is no relay. So you run alone, and then from there, when you die, you live with the information. So I think now that we've got this media, it is very important for us to mentor our juniors and the next generation to be better than us, so that we can continue. Yeah, without mentoring, you can see now we have in our government, we have old people there. They are not mentoring anybody. So one from the changes from one department to another. That's why we are having this problem we're having now. So I think this topic is a very, very important topic for us, so that we can keep on mentoring young ones and the next generation to be better than us. While we're still alive, it's much better to give some guidance. Yes.
Yes.
I think you don't have to stop. Thank you, and continue doing what you are doing.
Thank you.
Thank you, Prof. As we close, I see Priti Mukhari says, excellent presentation, Prof. Dedication and hands-on managers, team approach, leading by example. What a reviving presentation. And I think on the chat, there's just a lot. Zohra says, hi, Prof. Awesome and very powerful. I will try to present this to my managers. And we did a commitment from our colleagues. And really, colleagues, this is what we're all about. Today we learn, tomorrow we practice, next week we share and ensure that we change, one health worker at a time. Prof, your closing remarks, and then we call it an evening. Thank you.
Well, we said it, leadership can make or break an organization.
Yes.
But it can also lead to success. It rises and things can just grow, and especially creating those leaders, the mentoring. When we spoke about the mentoring unit also, that mentoring, guiding the young ones, because we cannot be selfish. We're not going to be around forever. There are others that's going to take up our position, and so on. I had a first year nursing student, and she did well throughout the whole program. And eventually she was my master's degree student. But today she's a professor. Now that is what one wants to see. That, now, they have grown and they are sitting up there and they're doing the things that you used to do, and even better also because they take it a step further. And that, but we mustn't be selfish. There's no such thing. There's no time for that, because the world is constantly changing, and constantly we need to come up with new ideas, new ways of doing things in a world that's complex. There's the resources are few. Our country don't have money, and we are always reminded of that. So we have to come up with ways of doing things better with less. That is the bottom line. You know, we don't want to exploit people, but if we work together as teams, that will, and get everybody involved. And, you know, I'm with Samla, and at Samla is that I work with, as their national chairperson, by the way. So here we have doctors, physios, OTs, everybody. And we know, you know, as a board and those in the provinces, we don't look at anybody by what you know, their professional status. We don't even look at that. They look at me, they say, well, some call me prof, some call me on my name. And there's advocates, there's lawyers, everybody of us, one big team. And sometimes I also feel that maybe I should be retiring, but there's no such thing as a word retire in my vocabulary. I don't know that word. You know, I will retire when my brain doesn't function anymore. We'll go. But we have what we have to give, we must give. Thank you.